This video will cover an introduction to sectional imaging anatomy of the abdomen. So we're going to start out by doing a quick review over some of the content that we talked about last week. So we mentioned multiple times what a small bowel obstruction looks like. So just to review, you want to make sure that you're able to visualize the plica circularis, which are one of the hallmark features of small bowel. So again, you can see those throughout this image quite well. And in the case of a distal small bowel obstruction, you should observe dilated small bowel. So again, you can see several regions that appear dilated compared to what you typically would expect to see. The location is going to be central within the abdomen. Again, remember your large intestine is going to be located peripherally, whereas small bowel is going to be located centrally. So that's where you'll always be looking for small bowel. And then you'll usually, when with a small bowel obstruction, note that the large bowel is collapsed, and again, that's going to be located peripherally, so you won't be able to well visualize the large bowel. And the plica circularis, again, as I mentioned before, are going to be easily identifiable across the full width of the dilated loops, confirming it to be small bowel and not large. Okay, so in this individual, you'll note that there are multiple air fluid levels in this person, and so that is indicative of a small bowel obstruction, as is the string of pearls, which you can see in multiple locations on this individual. But again, you can see some of these air fluid levels across here, which again are all going to be due to the number of them and the nature of them in this case. These are indicative of a small bowel obstruction. Remember that it is normal to have 2 or 3 air fluid levels in the small intestine under normal conditions. And then you'll see the step ladder configuration with the air fluid levels at different heights. That is also a sign of a small bowel obstruction, in addition to, again, the string of pearls and more than just 2 or 3 air fluid levels. And then you'll note that you don't see any air in the large intestine, which is another sign of a small bowel obstruction. So in this individual, you'll note now a large bowel obstruction. So again, you can follow the large intestine around. Here you can see the descending colon, where now suddenly it abruptly ends. And so the lack of gas distal to that location is due to the fact that there's a bowel obstruction at that point. And so you have collapse of the large intestine distal to that point. And so you can note the plica semicircularis, or the semilunar folds, which again, those are going to be what form the muscular sections intervening between adjacent haustra. In this patient, you'll notice a hyperintensity in the upper right quadrant. So you can see multiple sort of little rock-like appearances right here. So hopefully it's clear that would indicate gallstones within the gallbladder. All right, so we're going to start out today by going through, hopefully relatively quickly, through a number of cross sections, coronal sections, and sagittal sections. And so I think this is a really good review of the anatomy. So I'm not going to spend too much time looking at the images, because we'll be talking about those a little bit later. But for right now, I really want you to be focusing in on these images. The image to the right shows the approximate location where these were taken from, though I did not include images from every single level. But again, this is going to be the first image here, so you can kind of get a sense of where this section was taken from. So you can see a good amount of the liver with the hepatic vein showing up quite nicely, as well as the IVC. So keep in mind the location of the IVC. You can see the esophagus, as well as the aorta, and then the dome of the diaphragm over here as well. And then obviously parts of the lungs are going to be visible at this point here as well. So that all the dark through this region is lung, diaphragm, aorta, esophagus, and then IVC you can see over there. And the rest of this is all liver centrally. Go to the next image again, looking at very similar structures, but now you see part of the stomach now. So this is the fundus, and then you can see the spleen as well. So note the spleen here, and then the stomach here. But again, for the most part, the rest of the structures remain relatively unchanged. Moving a little bit further inferiorly, once again, now you're getting further into the body of the stomach. So again, you can see the body of the stomach here, the spleen over here on the left side, the patient's left. You can also note of course, the aorta located right here, and then parts of the diaphragm that you're seeing cutting across. All right, moving to the next level, again, you can still see the diaphragm sort of overlaying the aorta at this point. You can see the spleen quite well, the stomach. You can see some vasculature here coming off of the abdominal aorta. So you're looking at the splenic artery and the left gastric arteries. Both are just kind of coming up into to view, kind of a cross section through just a smaller segment of those vessels. And then here, sort of in the midline, we're looking at part of the portal vein. So again, you can see that outlined right through here quite well. And then of course the IVC you can still see kind of at the posterior medial margin of the liver, right around the caudate lobe. And again, you can't actually make out the caudate. So here you can see it highlighted right here. And then so that makes this the caudate located right here. Moving to the next image now, we have a much better view of the splenic artery. So this right here is representing the splenic artery going over towards the spleen, which once again you can see quite well. You can see the muscle layers of the diaphragm kind of looks like they're almost draping off of the aorta. Here's the IVC again in the just posterior to the caudate lobe. And then now in this next image, you can start seeing part of the pancreas. So here you see the pancreas, and a really important relationship on imaging in the abdomen is the pancreas with the splenic vein. So you'll see that cropping up quite frequently. So again, you can see the pancreas here, and then the splenic vein is sort of the somewhat lighter hyperintensity that you see located right around the pancreas. And remember, the tail of the pancreas is going to be sitting right up in the hilum of the spleen. So here you see the spleen once again over there. You can see more of the portal vein over here. So again, more portal vein coming across as it's branching into part of the right portal vein, IVC still, aorta, and then the common hepatic artery you can see also right through here. Next image, now you can see just a small part of the gallbladder. So again, you can see that shown here in green. So that's a notable new feature in this section. You can of course see the part of the stomach, and then moving down towards the pyloric sphincter as well. And so again, that's what we're seeing right through here. As you can see, part of the stomach, and then moving in towards the pyloric sphincter and the duodenum. So keep in mind that when we do a CT or an MRI on a patient, they are lying supine, and so it is normal to have the gastric bubble now in an anterior location as opposed to up in the fundus as we see on an upright radiograph. So just keep that, be mindful of that. We're also starting to see parts of the kidneys. You can see kidneys on either side right here, and so obviously those are shown well in the drawing, and we can still appreciate the right and left hemidiaphragm, at least part of the diaphragm on either side. Again, almost looking like they're branches coming off of the aorta, so don't confuse those with the aorta. And then you can see the celiac trunk where it's branching off of the aorta in this image. So here's the aorta, and there's a clear branch of the celiac trunk coming off of that. Again, quite clearly. All right, moving into the next image. So once again, the gallbladder, you can see a little bit better now in this image. Again, if we go back to the previous one, you can just make out just a very small part of the gallbladder, but now we can see it much better in this image here, again located in close proximity to the liver, as you'd expect. You can still see the spleen. You can see more of the kidneys now in this image. The IVC is also quite prominent, as is the portal vein, which you can see right here, and note the splenic vein again in close proximity to the pancreas. So you can see the pancreas cut across here towards the kind of in between the liver and the spleen over here on the patient's left. Moving to the next image, now we can once again we can see some of the renal veins cutting across to the IVC. So again, this is the inferior vena cava, and then this is the left renal vein coming from the kidney. So again, you can see that here's the kidney, here's the left renal vein. You can also see the renal artery in close proximity to that as well. Remember, those renal arteries are also branching directly off of the aorta to supply the kidneys. Next image down, now we can see both left and right renal veins going to the IVC, and just parts of the renal arteries there as well. So here's the renal veins on either side, and then again the renal arteries are you'll just kind of catch a small amount of the arteries as they're passing through. So we're seeing more small intestines now. Again, you're going to see multiple loops of small intestine. You also see part of the transverse colon coming across. So again, you can see transverse colon all right here, including the hepatic flexure. Whereas over here you see just part of the jejunum, and you can also see the superior mesenteric artery as it's going over the part of the duodenum. So keep that in mind. That's an important relationship. And the superior mesenteric vein is going to be located right next to it. So you can see the superior mesenteric artery and vein located right next to each other, just like the aorta and the IVC are located adjacent to each other at this point as well. And then now we can see part of the psoas muscles next to the right and left. Or I should say the left and the right kidneys. Moving to the next image, we're getting towards the lower poles of the kidney. So you can see the right kidney, we're almost past it, and then the left kidney, we're a little bit, obviously it sits a little bit higher up, so you can still see more of the left kidney. Here you can see obviously the aorta and the IVC, but you'll note that there are lumbar arteries that were picked up on this cross section coming off of the aorta to supply some of the structures of the back there as well. Okay, so then now we're going to move into coronal imaging in the next video.